Angela Webster is here to talk about infant mental health, and this is just fascinating to me, Angela. Thank you for coming in.
Thank you. We appreciate the opportunity.
Oh yes, this is like an area that I have really not heard about your organization, what you're doing, and it all makes sense. And as we were discussing before the show, the research has been there for, you said 40 years or something, but let's talk about your organization that focuses on infant and child mental health and about all these neurons that are developing in every second of a baby's life. Tell me about that.
Well, I can tell you about our association.
Yes.
We come out of about a 7-year grassroots effort of many people coming together interested in infants and young children and their families, and we were formed just about a year and a half ago, so to support the infant and early childhood mental health workforce.
Explain to us what that is and how critical child care, the people that interact with your baby, along obviously with parents, whoever's taking care of this child, such early stages, how critical that is to their emotional and mental health.
Sure. So the infant and early childhood mental health workforce is basically anyone who works in a professional capacity with children under the age of 5. So we're looking at anyone from early child care providers, early education, home visiting, pediatricians, nurses. It is a vast spectrum, and their role is so important because of the relationships that support babies in their development. So they support the parents, and we support the professionals.
Okay, so it says here in some of the notes I was given, early exposure to trauma and toxic stress is especially harmful to development. Of course, that makes sense. So it says, but also these babies and young children are more able to repair, learn, and grow from positive experiences than the older kids.
Right.
So expand on that a little bit for me, or maybe give me an example of toxic stress.
Well, toxic stress is stress that happens for prolonged periods of time without an adult or a caregiver that can provide some relief or some structure or some support. So it's critically important that babies and young children, and all of us of course, but particularly babies and young children, have to have supportive adults that are attending to their needs, that are ensuring that they have strong relationships, understand big emotions. All of those things are very important.
Does some of that include just obviously the nonverbal things, the holding the baby and the touching and kissing them and loving them and giving them a lot of warm feelings? They respond to that, obviously.
They obviously do. And there's something called serve and return, which we talk about a lot in Building Strong Brains, the governor's ACE's prevention and mitigation effort. In that, there's a lot of talk about serve and return, which is where you talk to a baby, they babble back. You talk back, they babble back. And it's that back and forth that helps to develop strong connections and helps to develop their brains and helps to mitigate stressful situations.
So it's sort of harder to undo some of the bad influences, right? It's much easier to influence them with the good versus going backwards and undoing bad behavior.
So we want to start early and often with babies. We want to be sure that they have lots of supportive measures, lots of healthy relationships, caregivers that they can depend on when they cry or when they have needs, or just when they're babbling and need someone to talk back.
How is mental health treated in infants and young children?
There are a variety of best practice approaches for clinical interventions. So if you are needing support for your infants and young children, you want to first be sure that you find someone who's been trained in infant and early childhood mental health. And that support is provided through the parent and through the relationship. So the parent or caregiver is always in that session or in that time with that professional who's lending assistance, and they're going to help guide the caregiver or the parent in understanding their baby's needs, and understanding their responses, and understanding their own roles. So we all have our own experiences, our own past, and our own things that are going on in our lives right now. And those clinicians and those that are trained in infant and early childhood mental health are going to be able to help determine what the impact is of me on my baby. So.
Is this something that a pediatrician could refer the parent to your organization, the Association of Infant Mental Health in Tennessee, would a pediatrician be the one to say, hey, listen, I think, we need to guide you to these folks to help you maybe learn better practices or whatever?
They could, as could home visitors, or people can self-refer children that are in the foster care system. The Department of Children's Services brings in infant and early childhood mental health clinicians to assist families that are caring for those children. But we actually don't provide those services ourselves. Again, we support those professionals who do, but we know where they are in the community and across the state, and we can help form those connections.
What kind of feedback are you getting? You said you haven't been in Middle Tennessee all that long. This
Right.
started in Michigan.
Infant mental health was largely born out of Michigan and their efforts there. We are actually statewide, so we're not just in Middle Tennessee. We actually are supporting the workforce statewide, and the reactions we're getting are huge. We brought a credential to Tennessee called the Infant Mental Health Endorsement, and it's specifically for those individuals that are working in the professional workforce. And we have over 200 applicants just since November, so the response is large.
Fantastic.
Yes.
So what are some ways to encourage the positive development of infant and early childhood mental health? Give us a few tips in our final minute here.
First, pay attention to babies. Pay attention to what they're telling you. Provide support. There are lots of interactions. Ensuring that the environment is appropriate. Basically attending to their needs and the relationships of the grown-ups around them.
All right, and last question, a few seconds. Where can I get more information on this?
Our organization is Aim High Tennessee, and so it is aimhightn.org.
aimhightn.org. Okay, Angela, thank you so much. Very
Thank
interesting,
you.
fascinating.
Appreciate it.
All right, and we'll be back in a moment.